Hi, my name is Erin Strife. I'm the Director of Healthcare Services for the Clinton County Health Department. I'm going to start with our numbers. We are at 64 lab-confirmed positive cases today, 3 probable, 41 suspects. At this time, that's a total of 108 cases with 95 recovered, 4 expired, and 9 who are currently actively ill. Today, I would like to talk a little bit about antibody testing. We still do not have our county-specific results from the testing that the state did at Price Chopper about a week and a half ago now. We do expect to get those. I was on a call with our regional epidemiologists yesterday, and the expectation is that those will be released to us, but we do not have still a date for when we'll get our county-specific results. I do know the governor has spoken on a broad level about regional results. That said, antibody testing is not necessarily a guarantee that a person cannot get reinfected who has a positive antibody test result. That is certainly the hope, but we don't know enough about the virus yet to understand well how long those antibodies would continue to fight a new exposure to the virus would last. So there are still a number of unknowns. Antibodies are part of our immune system's response to a virus. They help us fight the virus when the immune system, any type of pathogen, so that could also include a bacteria, but in this case we're talking about a virus. But they help the body fight the virus when they encounter it again because they recognize it and know how to handle it. That is a type of response that varies significantly between different pathogens. So it is a different type of immune response for measles, for example, than it is for pertussis. In this situation with a novel infection that we haven't had enough time to study very thoroughly yet, having antibodies may or may not confer significant protection, and we don't know the duration of that protection. So antibody testing right now is certainly interesting, but it isn't necessarily actionable in terms of a public health response. We still don't know as a health department exactly what we can assume based on someone having a positive antibody result in terms of how they should then act in the future. So we're continuing to recommend the same actions that we have been repeating: the physical distancing, wearing masks, the hygiene. All of those things are going to have to continue, and they will have to continue as we reopen. Reopening doesn't mean that those stop. It's exactly the opposite, actually. It means that we adhere to them more than ever, because those are what we know is going to work to protect ourselves. So briefly, I'm also just going to talk about how, with the weather getting so much nicer, we're all wanting to spend time outside, and we should. It's healthy for us to get out, but we still have to be physically distant from each other when we do go outside. That means we're staying 6 feet apart on sidewalks. If you have to step off of a sidewalk or cross a street to avoid encountering another person, please do so. Please don't ride your bikes on the sidewalks. That makes it really hard for people to stay safely to the side. And when we do go outside, just in general, even to a park, if we're sitting on a bench, we still need to maintain that 6-foot physical distance apart from each other, and we still need to keep our masks on. So keep up the good work, and thank you.